Welcome back to Health Awareness, where we strive to empower you with knowledge to lead healthier and more informed lives. Today, we're diving into an important and complex topic that impacts many individuals and their families: type 1 diabetes. Whether you're here to better understand the condition for yourself, a loved one, or simply out of curiosity, this comprehensive guide will help you grasp the essentials and beyond. So, what is type 1 diabetes? In simple terms, it's an autoimmune disorder in which the body's own immune system mistakenly targets and destroys the beta cells in the pancreas. These beta cells are crucial because they produce insulin, a hormone that regulates blood sugar levels and helps your body use glucose for energy. When the pancreas can no longer produce sufficient insulin due to the destruction of these cells, it leads to high levels of glucose in the blood, a condition known as hyperglycemia. Without enough insulin, the body's ability to utilize glucose for energy is compromised, which can result in a range of serious health issues if not managed properly. Type 1 diabetes often presents in children and young adults, but it's important to note that it can develop at any age. Despite extensive research, the exact cause of type 1 diabetes remains unclear. Scientists are actively investigating potential genetic, environmental, and viral factors that might trigger this autoimmune response. However, with appropriate management and a strong support system, individuals with type 1 diabetes can lead long, healthy lives. Now, let's delve into the symptoms of type 1 diabetes. Recognizing these symptoms early is crucial for timely intervention. If you or someone you know is experiencing any of the following symptoms, it's important to consult a healthcare provider as soon as possible. 1. Frequent urination. This occurs because the body is trying to get rid of excess glucose through urine. 2. Excessive thirst. High blood sugar levels can lead to dehydration, making you feel extremely thirsty. 3. Extreme hunger. Even after eating, the body may still feel hungry because it cannot properly use the glucose from food. 4. Fatigue. Without sufficient insulin, glucose cannot enter cells to be used as energy, leading to persistent tiredness. 5. Blurry vision. High blood sugar can cause fluid to be pulled from tissues, including the lenses of the eyes, affecting vision. 6. Unexplained weight loss. The body starts to break down fat and muscle for energy due to the lack of glucose utilization. 7. For children, bedwetting after being previously potty trained. This can be an indication that something might be wrong with their blood sugar regulation. It's also important to be aware that type 1 diabetes can sometimes be mistaken for type 2 diabetes, especially in adults over the age of 35 or those with additional risk factors such as being overweight. This misdiagnosis can lead to delays in receiving the correct treatment. If you suspect something might be off, or if conventional treatments for type 2 diabetes are not working, seeking a second opinion from an endocrinologist might be necessary to ensure an accurate diagnosis. For parents, spotting type 1 diabetes in children can be particularly challenging. A sudden return to bedwetting in a child who has previously been potty trained could be a sign of diabetes. Early detection is crucial as it can prevent serious complications like diabetic ketoacidosis (DKA). DKA is a life-threatening condition that occurs when the body starts breaking down fat at an excessive rate, producing ketones that can make the blood acidic. It requires immediate medical attention to address. Another term you might encounter is the honeymoon phase. This refers to a temporary period following a type 1 diabetes diagnosis during which a person might still produce some insulin. This phase can last from a few weeks to a year and may provide a period of relative control over blood sugar levels. However, it's important to understand that this is not a cure or a sign that diabetes is going away. It's a phase that will eventually end and ongoing management will be necessary. If you've been diagnosed with type 2 diabetes and find that the standard treatments are not effective, it could be worthwhile to investigate whether you might actually have type 1 diabetes. Specialized tests, including antibody tests, can help confirm the diagnosis and ensure you receive the appropriate treatment tailored to your condition. Managing diabetes, whether type 1 or type 2, can be challenging. It requires a proactive approach involving regular monitoring of blood sugar levels, adherence to medication regimens, and making lifestyle adjustments. However, with the right knowledge, medical care, and support from healthcare professionals, family, and friends, individuals with diabetes can achieve a high quality of life. We'll continue to explore diabetes and related topics in future videos, so be sure to subscribe and hit the notification bell to stay updated with the latest information. Remember, staying informed is the key to better health. Thank you for tuning in to Health Awareness. Stay healthy, stay empowered, and see you in the next video. And if you have not subscribed, you may not see us again.